Maharashtra that a cyclone, a very severe cyclone, is likely to hit the shores of Raigad. I immediately rang up my team and asked them that we need to talk, we need to ask, we need to discuss whether we are prepared to tackle a cyclone. And the first response that I got that none of us had any experience about handling any kind of a cyclone. This shore, for that matter, all of us are aware that there are lots of cyclones which are hitting the eastern coast, but hardly any on western coast. We discussed with the community leaders, we discussed with NGOs, we discussed with villagers, fisher folk, their communities, their societies, and inquired if they are aware of any memories of facing a cyclone-like situation on this shore. Unfortunately, this community on the shore, although they have been living on the shore, they never witnessed, say, a history of 100 years of Raigad would tell us that this shore has never seen any cyclone. So the first thing that came from community, that came from my own team was, it is not going to come. The very immediate response was that we have been hearing warnings of Kyar, Maha, Vayu, Okhi. These cyclones were going very close to the shore of Maharashtra, but they hit somewhere in Gujarat and never actually hit the shores of Maharashtra. And people were like, for past 4 or 5 years, the government officials come and they tell us to come from they tell us to take their boats out of the sea, but it never comes. But say, having heard this from them, having heard this from my team people also, where a slight sense of reluctance was observed that ye nahi hone wala hai. But somewhere that training that we got in disaster management and the lectures that I have also attended from faculty like you in my colleges, and because you must have read my biodata that I keep on reading, I keep on studying. So the very principle of disaster management that I learned was that one must prepare for the worst. One must believe that it is going to hit. It is going to come. It is not going to pass by the way Vayu happened or Maha happened or Okhi went without touching the shores of Maharashtra. So first thing that we decided that we would do as administrator, we would inculcate this belief in everyone from the top of administration as collector, the MPs, MLAs, the Sarpanch, to the people, to the fisher folk, to the community, that it might come. It is likely to come. Prepare for the worst and hope for the best. With that, those 72 hours that we had in the peak of COVID, because these were not normal times. It was the peak of first wave, when we as administrator a week ago were telling people to maintain physical distance, to wear masks, to not go close to others. And suddenly we were on the ground in the field asking people to evacuate, asking people to move from their residences, to move to safe shelters. Again, the difficulty that was added was because Raigad has never seen a cyclone. There were not a single cyclone safe shelters. So I was not even sure whether, say, the places wherein we are moving people. Generally, many of you must be aware that in monsoons also, people from dilapidated structures, people from shanties and hamlets also, which are having kacha houses, we shift them to government schools. But this was not that case. It was not just about rains. It was not just about heavy rains of Konkan, which occur every year. This was a cyclone added with rains, with COVID. So the shelters which we were identifying, are they cyclone safe? So it added a lot of difficulties. The first thing that we decided after all this interaction, that people don't have experience, people are not prepared for it, there is some kind of reluctance to move out of their houses, they're not ready to believe the administration that this cyclone is likely to hit. They are also confused that a week ago government was saying that stay where you are, and now we are saying that move out of your places and go to the safe shelters. So this is where the NDRF guidelines, the NDMA guidelines came handy. And when we went through those guidelines, we realized that somewhere this element of community resilience was part of our traditional structures. When I went through the NDMA guidelines of what houses are cyclone resilient, it gave me a sense of great hope and the belief that we are going to handle it well. Because I had say, uh, Praveen, can you move ahead with the
Yeah,
presentation?
yeah, yeah, yeah.
Yeah, I would be telling few things about probably what is disaster resilience and why resilience matters. Because the loss or the damages that happens during any disaster, if the community is resilient, the impact gets reduced. The psychological, social, economic help that the community extends during a disaster is the most important response that we can see during such disasters. And this was my personal field experience also, that more than the administration, more than the people like me, the SP, the Tehsildars, who were always there with the people in the field, facing it along with them. But more than us, it was the community which played a great role in ensuring that the people who are evacuated get safe shelters. As I already told you, because the shelters that the government has been assigning, some of them were not safe. Some of what probably can never be declared as cyclone shelters. So we needed to assign some houses of private people also, some temples, some mosques were also assigned as cyclone shelters. Any RCC roof structure was to be assigned as a cyclone safe structure, and people from the neighborhood were directed to move there. Likewise, what I was about to tell you, that climate resilient structures that our people have been building in Konkan, this Mangalorean tile houses, which are prominent in all the villages in Raigad and Sindhudurg, Ratnagiri. When you go, the houses with the hip roof and gable roof structure with the Mangalorean call का जो घर हम कहते हैं, this house, as per the NDRF guidelines, as per the NDMA guidelines, is the most cyclone safe house. And the moment we got these directions, these guidelines from NDRF, from the friends from Odisha whom I interacted with, to know अम्फन का डैमेज कहाँ हुआ, कैसे हुआ, कौन से घर डैमेज हो सकते हैं, कौन से नहीं हो सकते हैं. So this aspect, that our people have been living in cyclone resilient houses for centuries. They have been building houses which, especially the Kodiwadas, they were built in a way that they were cyclone resilient. And this gave a great relief to me. So the focus now was shifted to the houses which have been built off late, the monsoon sheds which were not permanent, which were not considered keeping in mind the ecological aspects of the area. This was where the focus has to be shifted. So we could pinpoint that these are the places where from the evacuation would be material. As already Praveen had told, that not just Nisarga, in the first wave of cyclone of COVID, we had cyclone Nisarga. In the second wave, we had cyclone Tauktae, and then followed by the floods of Mahad and landslides also. So all this together, I would somewhere tell you my experiences wherein the resilience of community was probably the most important contributory factor in providing relief to the people. In the end, I would just throw a little bit of light why this climate change and the way urbanization is happening on the shores of Maharashtra also is adding to reduced resilience in communities. Next. Disaster resilience, all of us know, is the ability of individuals, communities, organizations, and states to adapt to and recover from hazards, shocks, without compromising long-term prospects of development. In other words, resilience is the ability to flourish in the face of disaster risk. So particularly in case of Raigad, this district was facing crisis after crisis. This was a district which had 4 MIDCs, 3 big industries like Reliance, POSCO, JSW Industries, with migrants, more than 3 lakh workers from all over the country, which was stranded there during lockdown. So we had to handle that crisis. We moved to the first wave of COVID, came cyclone, and followed by a big building collapse in Mahad, then followed by second wave with cyclone Tauktae. All this was handled not just by the District Disaster Management Authority, but by the people of Raigad, who handled it in such a way that they actually survived. They survived it with their resilience because they extended help to each other. And I will explain it when I'm saying that in the face of multiple disaster, how the people of Raigad stood up to each other, and that's why they could handle this crisis so well. Next. So why resilience? Why are we talking on resilience? Why suddenly say we remember that for past 20, 30 years, there is a change in the very concept of disaster management, and lot of talk is there on making community resilient, and rather than making plans at the national level or the state level or making some ad hoc measures, why should the communities be made resilient? The immediate answer of this would be because first, the loss due to disaster is on the rise. Why the losses are much more than what was happening 100 years back or 200 years back when we were facing the same kind of disasters. This is on the rise because somewhere we have been losing on the resilient mechanism which were there in our community, the role of neighborhood, the social capital that our communities enjoyed is eroding, and more so in urbanized areas. Uh, Only after a careful analysis, we can say that the underlying resilience of the community can reduce the vulnerabilities that any community faces. A number of examples from the disasters all across the world would say that if the community is resilient, if the community has trust, has faith on each other, helps each other in times of crisis, the amount of loss, the extent of pain gets reduced. And this is exactly where my experiences come. And when I look at all this, how we handle, it was the community which was standing with us, somewhere invisible. But when we were evacuating people during Cyclone Nisarg, it was some 14,000 people who were in some 200 shelters of the government. But there were more than that people who were evacuated in the houses of their relatives, their neighbors, the sarpanch, the temple, the priest came forward. So this invisible hand of the community came handy, and we did not have to set up as many number of community camps, which otherwise would have happened if it would have probably happened in a community which was less resilient. Next. This is a brief about Raigad. It has got a total population of around 26.34 lakh, which now at present should be around 32 lakhs. 17 municipal councils are there, one municipal corporation, 122 kilometers of shore, which is beach wise. Otherwise, it is around 240 kilometer with the creeks, and 62 villages with population, these are mostly Kodiwadas, are located on the coastline. And coastal villages, this 1.73 lakh population was likely to be affected when Nisarga came. There are 103 landslide prone villages also in the district. This is probably the highest in any district in Maharashtra, which has got these many number of landslide prone villages. Why I have added the number of COVID hospital, because this added to the complexities that we were having when we were handling a cyclone along with COVID, because a lot of COVID hospitals were also not cyclone safe, and it required immense amount of planning to shift them from a hospital to probably another hospital which is cyclone safe. And it required a lot of support now from private hospitals, from the trust hospitals. And this is again where the community's support, where the community's response, proactiveness came handy. Now, the critical oxygen plant, 4 oxygen plants we had in Raigad, and this was supplying more than 50% of oxygen to the state of Maharashtra. This was most important for the entire state, because if these oxygen plants would be affected, the COVID second wave would not be managed. A lot of hospitals would not get oxygen, and we just cannot imagine the amount of life loss that could have happened if the oxygen supply would be disrupted. So this makes the district immensely critical, important, not just for the people of Raigad, as in 32 lakh people of Raigad. It was also important for Mumbai, which was getting oxygen from Raigad, for Thane, Pune, Satara, and many other districts which were getting oxygen from Raigad. The warnings, IMD warnings, I have mentioned about both these cyclones. The image on the right explains how the Okhi or Kyar or Vayu actually passed through but never hit the shore. This time it actually hit the shores of Raigad. The warnings were never more than of 72 hours. And that's exactly how cyclone formation happens. So the administration in 72 hours cannot suddenly turn the community into a resilient community, suddenly cannot build into a resilient community. The community has to be resilient. The community has to be a community wherein people care for each other, people have strong neighborhoods and support each other. It cannot happen that in 72 hours we will tell people and people would start helping each other. It somewhere is ingrained into the community. This is what is explained by this, that the warnings were hardly of 72 hours. Next. This is about the cyclone cycle or any disaster cycle. As I have told, what really mattered and what was the turning point for me, because I immediately talked to the officials from Odisha district and also the district collectors of Amphan affected districts. And this helped us. The discovery that the most of the houses in Konkan with the hip and gable roof structure are not going to be adversely affected. They are not going to be as damaged as the new modern structures, which are not so ecologically resilient. Next. This is how generally the district disaster management authority moves. Immediately we pass orders and every line department is assigned fixed roles, what is to be done by which line agencies is issued to each one of them under a proper order by the district disaster management authority. What came handy was, already because of COVID, we had Corona Dakshata Samiti, Corona vigilance committees, which were there in villages. So from my control room, from my office, we ensured that every sarpanch, every talati, every gram sevak, and the people, the NGOs which are working in villages, get a call from my office explaining what will be damaged and what can cause loss of life and livelihood to people, what can cause more damages, and how we need to evacuate. This information passing happened through the district disaster control room. The responsibility assignment, this probably, if you will hear from any other district collector, you will get to know that the NDMA Act empowers us to pass orders to anybody, even the private sector people can be directed to support the administration in providing relief to the people or in the preparedness activity. Somewhere I was also fortunate because Raigad was a highly industrialized district and a lot of development projects were going on. So we could seek help in the way of asking for JCBs and pokelans and dumpers, saw machines, wood cutters to clear the roads after the disaster takes place. And this was to be deployed so well that in 24 hours time, we actually had to establish connectivity with every tehsil headquarter. And we wanted to clear the roadblocks to ensure that we are reaching every village so that if at all there are any injuries or any immediate medical attention is required, the ambulances could go. The deployment of ambulances, fire tenders, and JCBs had to be very strategic. This aspect of the industries coming into picture, and this big CSR groups also helping, providing a helping hand to the district in crisis, to the people in crisis, also need to be asserted, because not just in COVID, but also both cyclones, somewhere I need to acknowledge that they were very responsive, and immediately all their machinery was available at the disposal of administration.